PSC.
It's the first briefing since the transformation of the Presidential Task Force to the Presidential Steering Committee on COVID-19, PSC. India's alarming COVID-19 infection and fatality rate is already sending shivers around the world. Although Nigeria's case positivity rate is less than 2.5% and cases requiring oxygen have drastically reduced, the PSC says Nigerians cannot afford to let down their guards.
Let's not be deceived. There will be a third wave. If what is happening in other jurisdictions is anything to go by, COVID-19 is not likely to go away very, very soon as we expect it to.
Cases in India and Turkey are of particular concern to us, and also Brazil. We must take this plight they have as a strong warning.
While we are opening these international flights, there is also a risk, that is the risk of importation of additional cases into the country. This calls for increased vigilance from the Federal Ministry of Health, the Port Health Authority.
We cannot afford another large outbreak in Nigeria.
The committee urges state governments to sustain advocacy for COVID-19 testing and vaccination, pointing out that the current 58% vaccination rate for the first dose of the Oxford AstraZeneca vaccine is nothing to cheer.
The federal government has rationalized the vaccination exercise by preserving 50% of the available doses of the vaccines for administration of the second doses. We anticipate a delay in vaccine supply to Nigeria.
60,000 COVID-19 test kits were donated to the PSC by the Victims Support Fund. The risk of contracting COVID-19 is not over. This is why the Presidential Steering Committee says adherence to the preventive measures of wearing face mask, washing of hands, and observing physical distance should not be overbearing for Nigerians. In Abuja, Mitaire, Ikpen, NTA News.